gentlemen, today we have a very important, timely, and exciting session because we're talking to a plastic surgeon. I know you have been asking on the internet what it is that you can do. You know, there's a wedding coming up, there's some things that you needed to, have fixed, and you don't know where to go. You don't even know where to begin. And today we have with us Dr. Tilman Stasch. I hope you have said your name right, Stasch.
Perfect.
Perfectly.
Yeah.
Dr. Tilman Stasch is a plastic surgeon here in Nairobi. I'm going to let him introduce himself. But he's been a plastic surgeon for a lot of years, and over the years he has amassed a lot of experience. So when you talk about things to do with your body, when you talk about plastic surgery, a lot of the times the mind first goes to your body, and we see a lot of these things in the internet, and we see a lot of before and afters. So today we are here to answer all those questions that you may have. Perhaps you have wrinkles and you want it gone. Maybe you have an issue with the shape of your nose and you need it to look in a certain way. Or even you have some fat that is not going away and your wedding is coming and you want to look really good. And for the men, I'm sure there's, a lot of men go through problems, say, with the is it for man boobs?
Man boobs, yeah.
Yes, man boobs. And so Doc is here to answer all those questions that you may have. And Dr. Stasch, first of all, thank you so much for having us here. This is so exciting, and I'm sure we're going to learn so much more today. But first thing first, plastic surgery.
Yes.
There's invasive plastic surgery and non-invasive plastic surgery. If I'm not wrong. But before we even delve into that, maybe you can just quickly give us a brief introduction of yourself and
Sure.
the good work that you do over here at Vitality Fountain Clinic.
Thank you very much. Thanks for having me. So Tilman Stasch is my name. I'm a plastic, reconstructive, and aesthetic surgeon. So that's the lengthy title. It encompasses everything I do. So I don't only do beauty, I also do the reconstructive work. So as a plastic surgeon, I think I've worked for over 12, 15 years already. I graduated from medical school 20 years ago in Cape Town. And since then, my only aim was to become a very, very good and trustworthy plastic surgeon. Being German, I hope I can take the skills and the kind of attitude that I have from my home country in order to do the best for my patients here in Kenya. I've been here for about 9 years. Okay, so in this clinic, I think next year we're going to celebrate our 10th anniversary. And over the years, the patients have come, and the numbers are growing, and certainly all ages. Okay.
All ages, yeah.
So it's wonderful to be here, and I'm very happy to share some of the secrets of plastic surgery, maybe demystify a few things, and just talk freely about what is available, what is possible, what is safe, what is good, what is not so good, and maybe answer a few more questions that your viewers might have.
Okay. That is very good that you have said demystify, because I think for us in the wedding space, the big question is, we know about plastic surgery from the surface level, but when we really want to get into that space and to learn a few things, we don't know where to begin. So I'm sure for you, over these years of experience, you've had a lot of women come in, a lot of men come in, and they have all sorts of issues, I can imagine. But say, just at the top of your head, what would make someone come here?
I think from the top of my head, most people who get married, obviously, they don't need anything. Okay, so they're very happy with themselves. They go to the gym. They do a detox diet. They kind of do their very, very best to look the best on that special day. Okay, so I think that's important to say. Then you have the kind of treatments that are kind of a bit more common, the spa treatments, the facials, the pedicures, the manicures, the waxing, and so on. So just to make you feel good, to optimize your body on the day. So all of these things can then be upgraded, okay? So from a normal spa, we then, like the services we offer, a medical spa, so you can get medical facials, you can get like minimally invasive treatments like lasers, microneedling, radiofrequency, things like that to get your skin glowing. Then you get, and you mentioned it at the beginning, the kind of, you call it non-invasive. We would say minimal invasive things like facial injections, Botox, fillers, and the like, in order to smoothen the wrinkles and just to give your face a fuller appearance and a rejuvenated look. And then you can graduate to the more kind of what one would say invasive procedures, starting with body contouring, weight loss surgery, liposuction, etc., etc.
Okay. So we start with the basics, the wrinkles, and as you said, non-invasive, or what was the word that you used? Fairly invasive.
Minimal invasive.
Minimum. So we start with that. And when we talk about wrinkles, a lot of times you'll find that the people who are a bit older, like the mothers of the brides and the grooms, would come for that.
I have a lot of that, yes.
Yes, because in the wedding space, in as much as it is your wedding, it is your mother's wedding.
Right.
In so many ways. So obviously she'd want to look good. She'd want to take care of a few things on their face. So Botox.
Sure.
In layman's language, what is that? And how can they? Who qualifies for Botox?
Okay, Botox is a very wonderful medication. It's a drug. It's a substance that is injected mainly in the forehead area. It is a toxin, so in layman's terms, I would say it's a protein that attaches to the muscles, and it basically tells the muscles to slow down. So somebody with a very expressive face, frowning, raising your eyebrows, wrinkling on the forehead, the crow's feet around the eyes, they will find Botox really helps to just calm the face down. And as you would put a piece of clothing, like a dress, in the cupboard and wait for a few days, suddenly the dress will be very smooth and wearable. So the same with Botox. So Botox are just fine injections into the face to just smoothen. So there are injections in the glabella area, the frown lines, then the forehead area, the wrinkles around the eyes, and then there are other areas like the smoker's lines, etc. Those are a bit more specific. But the aim of Botox basically is to give you a relaxed and rejuvenated look. So I always tell my patients, nobody will tell you, oh, you've had Botox. That is the frozen look. That is if you use a lot of Botox. The more kind of common approach that I take is just enough Botox to smoothen out the lines so that people tell you you've been on a holiday.
Yeah, you look
way too relaxed for a wedding. Yeah. How are you doing? Very good. So that's Botox. Now filler, on the other hand, is hyaluronic acid. Hyaluronic acid is a substance that occurs naturally in your skin, and that is used to fill deep creases. So the nasolabial folds, and you inject the filler. Sorry, and it basically lifts up those deep lines.
Okay, so that's a filler.
That's a filler. So the nasolabials, higher cheekbones, lips, smoothen out the lines on the jaw, etc. So that is done with filler, and it usually applies for patients who are a little bit older, who might have lost a little bit of volume in the face and therefore have saggy skin. Okay.
So, yesterday I asked in my Instagram, I said I was going to interview you, and I asked them if they have any questions. And someone asked, if I get Botox, will I always have that, surprise look? Like, will I be able to change expressions?
Yeah, you don't. I think there's a lot of myth around that, and exactly that frozen look, the Spock lines, the surprised look. You can't even have any facial mimics anymore. That's pretty much 90s. So nowadays.
Or is that an effect of too much much Botox?
It's too much Botox. So it's the surgeon deciding, or the practitioner just giving you too much Botox. But sometimes patients want that.
Okay.
They want to have that look,
Yeah.
but it's not requested as frequently nowadays. So the ideal Botox treatment would be, hey, you look really good. you must drink a lot of water.
Yeah.
And then they just say, yeah, we drink a lot of water, but they don't tell it.
You look surprised all the time, like, oh my god, and it's not going down, your eyebrow. So that's too much. That's the 90.
So that's now complications with Botox. I think you have to you're alluding to the droopy eyelids and the brows.
Mm-hmm.
I think as long as you go to a very well established practitioner and a specialist, these complications are extremely rare.
Okay.
Yeah.
So we have spoken about Botox for the older ladies and even gents.
Even men come for
Yes.
Botox and fillers, yeah.
And that's non-invasive. And what else is there that it can be done without, going into the skin?
Okay, so if we're talking about timelines, for instance, yeah, so Botox and fillers can be done, I would say, minimally 3 weeks before the wedding. Ideally, you want to probably do it 4 to 6 weeks before, because it just takes a little time to settle in for you to kind of just get the full effect of the substances.
And how long would they last?
They last for 3 to 4 months fully, the Botox, and fillers 6 months to 1.5 years, depending on what type we use.
Okay.
Now, other treatments that you can do kind of in the panic mode just before the wedding, 4 to 6 weeks before, are things like microneedling.
Microneedling. I just hear that. I hear a lot of needles, like small needles. That's what that is.
So microneedling is a medical procedure where in our clinic we numb your face first for half an hour with a numbing cream, and then apply a device called a dermapen with 12 tiny little needles, and then you can set how deep you want to have the needles penetrate through the skin. And the effect basically is that your skin rejuvenates because it tries to heal the micro trauma. And by healing, it tightens the skin, it reduces scarring, it reduces pore sizes. It can also reduce pigmentation. So it's a all-around safe and quite efficient method. It has to be said that one treatment usually is not enough. Okay, so because it's minimally invasive, because it's quite gentle, because there's no downtime, maybe 2-3 days, you have to repeat it. So ideally with that you start probably also a few months before in order to have regular treatments. It's not painful as long as you use the numbing cream, and the downtime is just a few days.
Is it okay for people who have, keloids?
Well, people who tend to scar badly, it's safe for them, but obviously we would start the first treatment very gently, and then just see how they heal.
It's so sad because I have keloids and I have been exempted from so many things. I really wanted to do the permanent, I can do it. I wanted to do I don't know what. I think you
But
can.
even for that, keloids on the face are extremely uncommon. Okay. And for patients like you, we would do a patch test. So we would kind of treat a small amount of, in the tattoo area, small amount of ink, or we do a patch test with a laser behind your ear, and then we just see how you react to it, and then we wait for 4 to 6 weeks. There's hope, yeah. And as long as we do it safely and carefully, mostly it's possible, yeah.
Okay. So even as we get, to learn more about the face, the nose, sometimes people are just not comfortable with the shape of their nose for one reason or the other. And, now we know that there's a procedure called rhinoplasty.
Right.
And you do it here?
Yes, so of course not everybody can have a beautiful nose as yours.
Oh my God.
So rhinoplasty is a surgery that can be done to shape the nose surgically. I personally don't perform it because I believe strongly that somebody doing rhinoplasty needs to go to a specialist who just does that. So if you want to have your nose operated, then go to an expert who just does rhinoplasty or nose jobs, because it's a very, very difficult and very delicate procedure where you also need a lot of time for the healing, etc. And I found myself not having the passion to go into that field because I do everything else on the body. And I just found that if you want to do a really good rhinoplastic surgeon, then you just need to specialize on that. However, the good news is we do what is called a non-surgical rhinoplasty.
Non-surgical.
It's a very, very effective and popular way of shaping your nose with fillers.
Oh, the same fillers that are going...
The same fillers that we can build the cheeks and the jawbone.
Yeah.
So those fillers we can nowadays shape the nose. So maybe even it out, just make it smaller, make it broader, extend the tip, things like that.
Wait, when you talk about these fillers, can they move?
No, once the fill is done correctly, they don't move.
They don't move.
Yeah, they don't move, and they can last for up to 9 months to 12 months, depending on about a year, and then they can be redone again.
Okay, so there's hope for people who
don't want to have surgery.
Yes. Still on the face, there's people who have droopy
bags under the eyes.
Yeah, the eye bags. And sometimes all the makeup in the world cannot fix that.
Right.
So they have eye bags, and also they have the double chins, so to speak.
Okay.
Or even the droopy cheeks. Is this something that you do here to fix that?
Yeah, I mean, those are 3 different areas. Maybe start with the lower eyelids or the eye bags. Very, very popular question is, how can I remove my dark eye rings under my eyes?
Yeah.
So there are various methods. So it obviously always depends on the patient. So if you come in to see me, I can't tell you over the internet, okay, this is what you need. I need to see you personally.
Yeah.
Filler is one method to fill in the deep valleys that may cause shadowing and thereby giving you dark circles under your eyes. Other products like Botox can also help with that area. Then microneedling is also an area a technique that we use to help the skin thicken up a little bit. And the last one, which is also quite popular, is PRP. So that platelet-derived plasma. Have you heard of that? That's when you take blood from your arm, you spin it down, you use the platelets, and then that can be injected into your eye bags.
A lot of functions, because I've heard the same thing can be done for other areas of
for hair growth, yes, and also
even
for rejuvenation.
Yes, for the all shorts and whatnot.
And for down there, yes, that is true as well.
Yeah, that's what I heard it from. So that's interesting.
So that's for the eyes.
Yeah.
For the neck, very similar. We do something called a vampire lift.
Vampire.
So if you Google that, then obviously you see Kim Kardashian doing it all the time. So that gives you the glowing kind of skin, the glowing complexion of your face. That is microneedling combined with PRP. And that just rejuvenates the skin from outside and from the inside.
Okay. So if someone came here, first of all, you just have to sit down with them, take them through, or they'll take you through, their issues, and then, a general consultation.
Sure, yeah.
If I walk in here today with an issue on my face that generally does not require invasive surgery, what's the time frame by the time I walk in here to when I walk out with my procedure done?
Yeah, I think that's a great question, because the expectation sometimes is, doc, fix my face, I have a wedding in 2 weeks.
Yes.
And then I kind of say, that is a bit tricky. So we always give 3-month therapy plans, 3 or 6 months. In 3 months, you can achieve a lot. So most of the treatments, be it creams or radiofrequency or microneedling, will have lasting effects after 3 months. Okay? So I would then sit down and ask you, okay, what is it? Is it your dry skin? Is it your oily skin? Do you have acne? Do you have scars? Do you have wrinkles? Do you have hyperpigmentation? And then I can sit down with you and give you a list of procedures that we would recommend. We use the Lamel skincare range. Those are cosmeceutical products which have high medical grade ingredients. like vitamin C, retinol, etc., that actually change things on your skin. Then the other methods that I mentioned, I think there's then lasers as well. The superficial lasers, almost like microdermabrasion, and then the deeper lasers that definitely also help to rejuvenate. So for me, the combination of these procedures will have the desired effects.
Okay.
Yeah.
So guys, we have been talking about everything non-invasive. We are going to start talking about invasive. This is a very exciting part of the conversation because now we'll be talking about everything that we have been seeing online. The BBLs, the liposuctions, the boob lifts, boob jobs and whatnot. So be sure to stay tuned as we get into the next session of the conversation.